And just as an American doctor who works in the United States, I remember when Ukraine had hospitals that were targeted, that the American Medical Association came out very strongly and appropriately saying hospitals and healthcare workers can never be targeted. For some reason, that is not happening in the Gaza Strip. We're not hearing voices as loud. We're not hearing professional societies like the American Medical Association come out against that. And so that's what happens. You have people like Dr. Ahmed, whose patients totally depend on him, but he's at risk of death. He can be killed, and that's not an overreaction. It has happened. Over 300 healthcare workers have died. Your show, your program reported on Hind, the 6-year-old who was stuck in Gaza City, who was talking for 3 hours to the dispatcher from the Palestinian Red Crescent. She was waiting for somebody to rescue her. And then when an ambulance with 2 paramedics were trying to reach her and were given the green light and coordinated with Israeli authorities, they were bombed and killed, and Hind was left to die. She had died. And this is just another chapter in the assault on the healthcare infrastructure in the Gaza Strip. And so every way you look at this, it's an absolute tragedy. Most of these professional societies, especially when it comes to the healthcare professions, have been silent on the Gaza Strip. And if you try to broach this subject, it's what we're being told is that this is a very politically charged and polarizing topic. I reject that totally. That's unacceptable. It's not political or polarizing when you're talking about children who are hungry, just like you reported early in the show. It is not political or polarizing when you're talking about being able to treat patients, people getting dialysis, making sure that somebody doesn't bleed to death. It's not political or polarizing when you're asking for antibiotics.